Okay, be honest. Did anyone actually warn you your body would feel this wildly different during pregnancy? If you're nodding right now, take a deep breath. You are absolutely in the right place. Hi, everyone. Welcome to This Explainer. I'm a senior pelvic floor physiotherapist from OVA Women's Health, and today we're diving into a topic that affects so many moms-to-be, but honestly, it gets brushed off way too often as just part of the process. We're talking about pregnancy-related lower back pain. We're going to break down exactly what's happening in your body and, more importantly, how you can actually get some real relief. So let's talk about what you're feeling right now. Maybe you've noticed this deep ache in your lower back after just a short walk, or that sharp twinge when you try to roll over in bed at night. Does it feel like something you just have to kind of tough out? Look, so many women are told that because you're carrying extra weight, pain is just inevitable. But I really want to validate your discomfort here. Yes, feeling these shifts is super common, but being in constant disruptive pain, no, that is absolutely not something you just have to silently endure. To put this into perspective, the sheer scale of this is pretty staggering. Up to 70% of women experience lower back pain during their pregnancy. 70%. So if you're sitting there rubbing your lower back right now, please know you are so not alone in this. Your body is going through literally one of the most profound physical transformations a human being can experience. It's doing exactly what it's supposed to do, but that doesn't mean it couldn't use a little helping hand along the way. Here's the absolutely crucial takeaway. Persistent pain is a sign your body needs support, not just something to tolerate. Pregnancy is a beautifully natural process, right? It's not a medical problem that needs to be heavily managed. Instead, I want you to think of this discomfort as your body's check engine light. It's simply sending you a signal saying, hey, the structures supporting your spine and pelvis, yeah, they're working overtime. They just need some specialized, nurturing support to keep you moving comfortably. Okay, let's dive right into section 1, the anatomy of the shift. We'll look at the biomechanical changes going on. To figure out how to fix the pain, we kind of need to peek under the hood first. No crazy medical jargon, I promise. Let's start with your chemical messengers, the hormones, specifically relaxin and progesterone. Now, these are brilliant, totally essential pregnancy hormones. Their main job is to soften your ligaments and connective tissues. Why? Well, your pelvis needs to be flexible enough to actually let your baby enter the world safely. But the catch-22 of this wonderful softening is that it naturally dials back the stability around your spine and pelvis. Your joints are suddenly way looser than they were before you got pregnant, which means your muscles, they're working double time just to keep you upright. And it's not just the hormones doing this. There are a few other massive shifts happening all at once. As your baby grows, your weight distribution completely flips, pulling your center of gravity forward. This puts a ton of extra pressure straight onto your lumbar spine. Then we have to talk about stress. We all know pregnancy can be incredibly stressful, and that stress actually causes you to subconsciously clench and tighten your pelvic floor and lower back muscles. And that manifests directly as pain. So all these internal shifts lead to some pretty profound postural changes. To balance out the weight of a growing uterus, a lot of women naturally adopt what we call a sway back posture, where your lower back arches really deeply, or a rib flare, where your chest kind of pushes up and out. These are completely natural compensations, but they effectively overwork those lower back muscles, which leads right to that deep stiffness and sharp pain you're probably feeling. Moving right along to section 2, how physiotherapy brings relief. Let's talk about some safe, actionable steps using a whole body approach. You might be wondering, should I just wait until the baby is born for this to magically go away? The short answer is definitely no. Addressing this early is huge. Untreated lower back pain doesn't just hurt, it literally messes with your ability to walk, to climb stairs, and maybe most importantly, to get a good night's sleep. Beyond that, it can really impact your pelvic floor function and even your emotional well-being. By stepping in early with physio, we aren't just putting a Band-Aid on the pain today. We're actually supporting your long-term pelvic health and setting you up for a much smoother labor and postpartum recovery. So what does a treatment plan actually look like in practice? Well, we use a highly effective 4-step approach. Step 1, we do a really thorough postural assessment to find the exact root cause of the strain. Step 2, tailored exercises. And don't worry, these are incredibly safe, gentle, and perfectly adapted for whatever trimester you're in. Step 3 is manual therapy, and Step 4 is daily movement modifications. Let's actually break those last two down a bit more, because they are absolute game changers. Now, when you hear the phrase manual therapy, it might sound a little intimidating, but honestly, it is one of the most soothing parts of our care. It's really just gentle, hands-on techniques. Your physiotherapist will use specific soft tissue release and myofascial mobilization to literally melt away the tension in those overworked muscles. It restores mobility to your spine and helps with pelvic alignment. Think of it as creating some much-needed space and comfort in a body that feels, well, increasingly crowded. And then, of course, we have your daily life because, you don't live in our clinic. You live in your home, at your job, sleeping in your own bed. So we teach you highly efficient movement strategies to actually protect your spine throughout the day. We're talking about practicing safe rolling techniques in bed, exactly how to get up without straining, how to sit and stand with the best support, and safe bending and lifting mechanics. I know, they might sound like tiny little details, but I promise you, these small, everyday tweaks make a massive compounding difference in how you feel. Which brings us to Section 3, partnering with OVA Women's Health, your pelvic health experts. Listen, when you're pregnant, you really don't just want a generalist. You need an expert guide who understands the very specific nuances of exactly what your body is doing right now. At OVA, our entire clinic identity is built completely around women's specific needs. We bring extensive global training in prenatal and pelvic health to literally every single session. But what makes us truly different is our whole body approach. We know lower back pain is almost never isolated. We aren't just going to rub your back and send you home. We look beyond those symptoms to check your breathing mechanics, your rib mobility, your hip mechanics, and how your deep core is activating. We treat the whole system safely and effectively. And part of our commitment means being there when you actually need us. We all know pregnancy doesn't care about a strict 9-to-5 schedule, right? Sometimes symptoms just escalate quickly. So if you're dealing with severe pain, sudden sciatica shooting down your leg, or even really urgent postpartum stuff like clogged milk ducts, which we actually treat with specialized ultrasound therapy, by the way, we offer emergency urgent appointments outside of regular hours. We just want to remove every possible barrier so you can get immediate, compassionate care when your mobility or your sleep is on the line. If anything we've talked about today is hitting a little too close to home, please take a second to scan the QR code here on the screen. It'll take you straight to our booking page at OVA Women's Health. You truly, truly deserve to feel supported, confident, and physically comfortable in your pregnancy. Our clinic is this warm, welcoming, and entirely judgment-free zone, and it's designed specifically to help you thrive. Our schedule does fill up, but if you're ready to find some relief, we are absolutely ready to help. Pregnancy is such an incredible journey of creating new life. But hey, your quality of life matters right now, too. It is time to stop just tolerating the pain and start listening to what your body is asking for. So what do you say? Will you take the first step toward a stronger, more supported pregnancy today?